So the people who've been on the sessions during this week know that we really want to thank all the student careers team people, Kamal, Rabina and Imtiaz, for your hard work, the Western Careers Hub staff who've been awesome, the generosity and commitment of each of the presenters, and also the academic and professional staff of social sciences. And we love the fact that you're enthusiastically and very present here today. And we hope that the questions put in the chat box will be answered, but also that each question you put in speaks to each of us potentially about other areas to explore and to think about. So please put in your questions because we all grow from that. So over to Kamal for the housekeeping.
Okay, everyone, good morning. I want to let you know that these sessions will be recorded and we are hoping to make this available via course sites. During this session, we ask you to put your video on if that is possible, but if not for any reason, we suggest add a professional photo of yourself to your profile, and in that way you will be represented in this session. We are hearing from presenter who may be interviewed by one day soon. We also ask people to mute your microphones while presentations are happening. Each session you attend, we ask you to please put your name and student identity number, and this will enable us to provide a certificate of attendance. This will also enable you to be in running for the Lucky Zoom raffle prize of $40 cash voucher, or for people who attended at least one of the week's session. The Lucky Zoom winner will be drawn at the end, final session of the week, 3 p.m. to 4 p.m. Friday. If you put your name in the chat in any session from the Social Work Careers event, you will be included in the draw. And we will send an email to your email ID to advise you. Remember, if you have any question at any time, could you please put it in the chat box, and we will ask the presenter during the question and answer session at the end. Thank you so much. Now Siobhan will start.
Thank you. Thank you for having me here this morning. Good morning, everyone. I'd also like to acknowledge the Cabrogal people of the Darug Nation on which Liverpool Hospital is based, and acknowledge any elders past, present and emerging. We've had a great NAIDOC week actually at the hospital, and I am lucky enough that I actually share the social work department with the two Aboriginal liaison officers of the hospital. So we've been having really spirited conversations about how we look at Aboriginal culture in regards to our health practice and how we work. In particular, yesterday we were talking about with birthing mums and how we get that spirituality back, and how we they are able to earth themselves and immerse themselves in their culture as well. So it's really great that we're getting so much more voice to the Indigenous people, you know, in health, but also in the wider community. So moving on from that, thank you very much. I think this is my third year of talking about social work in health, and you know, I'm happy to help with any you know, tips and advice to give you if you are interested in having a career in health. I know that placements in health are always highly coveted, and obviously that translates into career opportunities for people as well. So I'm a social worker. I was a Western Sydney student social worker back in the 90s. I think I'm coming up to about, my 23rd year of being a social worker. So I graduated in the late 90s. And I was lucky enough that I had 3 placements, 2 which were in health. And one was at the Children's Hospital, and the other one was out at Governor Phillip Hospital, which was a rehab hospital out at Nepean. I've worked at Liverpool for most of my career. I'm currently the student educator, so I look after all the students that come on placement from all the unis that offer social work degrees. But I also have a clinical load, which is really important that I keep up with my clinical skills and my clinical practice. And so I call myself a neurology, neurosciences social worker because that's what I've done for the bulk of my career. But I actually started in the community. I started in community health in aged care, again, still in health, but I was doing aged care home visits. I was working with the rehab outpatients, some rehab hospital work. It was quite diverse those first couple of years. And interestingly, it was as a sole social work position. So there was a lot of learning within that about working with other allied health, and also just establishing, I was learning who I was as a social worker, but also trying to help define that role while I was actually also learning it for myself as well. So solo social work jobs first out is hard going, but I think it does actually really character develop you. It really does help you really get a sense of what sort of worker you are, what your resilience is like, and you really have to learn to speak up and represent and advocate, because often the social work voice can get lost if there's one of many within a multidisciplinary team with no other social work backup. So when I came to the hospital, I worked in neurosciences, which is so neurology and neurosurgery. So people who have brain tumors, strokes, they have epilepsy, multiple sclerosis, any of those sort of neurological conditions. People were being diagnosed or being chronically treated was where I largely worked. The great thing about health, and what I do love about health, is that it's been far from boring. It's been very diverse. So within that time, I've been able to, I worked at Barrel for almost 12 months where I was managing down there. I work at Bankstown in an after hours capacity in a ward separate to my day-to-day work. And it's just a way I find to keep my skills current and to flex different muscles and to work with different people and having to get out there and not get, for me, it's not a matter of not getting stale. Now, a big hospital like Liverpool has also afforded me the opportunity to do after hours work. Liverpool Hospital is the largest teaching hospital in the area. We're a major trauma hospital, so we're on par with Westmead, North Shore, PA, and most areas will have a major trauma hospital where all the more complex cases come. And as a result, we virtually run a 24/7 social work service with on-call coming from 11 p.m. at night as well. So that's afforded me lots of experience, not just in critical care, which is where I'm based, but it's also meant that I've had to work in women and child's health. I've had to work with, grieving mums who've perhaps lost babies. I've had to work in mental health after hours when there's been some critical incident. I've had to work in palliative care, cardiac, lots of different areas. So your skills are what your skills are. It's the what I found is that those transferable skills have meant that I can work across those areas with a degree of competence as well. So as I said, I'm currently the field educator, which is my dream job. I'm really loving it. I love looking after students, and I very much enjoy sharing my skills and knowledge. And the other thing that I do like about health, which works for me, is that I'm part-time, but it always has the opportunity to, there's full-time work, there's part-time work, there's after-hours work at Liverpool in particular. So there's so much diversity and choice as well. So as I said, so the next slide I think has got the makeup of, so I'm talking about health in Southwest Sydney, but health is a state government agency. So I work for the state, and specifically it filters down into the local government areas largely. So Southwest Sydney is where we sit, but you can see there the other local health districts that we're split into. And as I said, most of those all of those local health districts will have a major trauma centre within them. And working in a big hospital or a small hospital, there's advantages and disadvantages to both. It just depends on I guess your style of work, what you actually enjoy, where your passion really lies. As I said, I'm in the hospital. I work at the hospital, so my work is inpatient, but there is such a vast array of social workers that work across all elements of health. We have drug and alcohol counsellors, we have mental health workers, we have sexual assault workers, we have people who work in immunology and HIV, sexual health, and they're often in clinics, and they're often not in the hospital, they're often out. We've got aged care people going out and looking after complex issues in aged care. Aged care is a bit of a funny one because it straddles federal and state government. So funding and role delineation can get a little bit murky at times, but at the end of the day, they generally work quite okay together as well. So that's what the sort of health largely looks like. There's lots of opportunities in health in rural areas, and I would encourage anyone who has some sort of rural connections or interest. There's some really great opportunities out there, and it does often mean that you're a solo or one of a smaller group of practitioners, but there's such diverse experience that you can gain out there. One of our girls who's just started with us actually had been at WSU for 12 months, loved it, got lots of experience, has slotted in really well with us because she brings a lot of that experience with her as well. So in our department, the departments relatively sit the same across health. In our department, we're a large department. There's over 60 of us in the department at Liverpool across 6 teams. That's about 40 to 50 full-time equivalent stuff. We have a fair whack of part-timers as well, but we're a fairly large department. So on the next slide, it actually has what teams that we are split into. So generally, because we work within health, we follow the structure of how health is split up. So that's things like, we follow the medical teams to a certain degree. So the critical care team is the team that I sit in. So that's your more complex surgical type cases, emergency intensive care, neurosurgery, general surgery, trauma orthopedics, which is where I'm currently sitting. All that sits in within critical care. Chronic and complex is more your respiratory, palliative care, oncology, aged care, inpatient aged care type cases. Women and child health is maternity, drugs in pregnancy, newborn care, neonatal intensive care, teen young mums pregnancies as well, a lot of antenatal work. So that's that team where they sit. And then we've got, we're fortunate at Liverpool, we actually have the brain injury unit, one of 2 in Sydney. One of them sits with us. And so as a result, we have a brain injury team, which is a specialised team of professionals that work with people who have significant brain injuries from trauma. So generally either car accidents or self-harm or, something significant's happened to their brain from some sort of accident. Then we have our mental health team. So we have inpatient and outpatient mental health. We have a large mental health inpatient. We have a few wards here that deal with people of varying levels of harm and recovery with mental health. And so we have a specialised team there. And then we have our aged care and rehab team who, again, as I said, straddle state and federal legislation and funding. And that is largely in the community where they're doing the aged care assessments for people who need to go into care. And then we also have a specialist rehab team for really complex cases, often people in the community who might have motor neuron disease, Parkinson's, just really debilitating conditions that need a lot of specialised intensive support in the community as well. So that's what our teams look like as the inpatient Liverpool. That there would be variations of this across all departments in Metro Health as well. So the great thing about health, and the thing I probably like about health, is that it's diversity. So on the next slide, we talk about the range of services that we provide in health. And the good thing about health is that anyone who rocks up to an emergency department, regardless of who they are, where they've come from, what their insurance is, how serious or not their condition is, they'll be seen. We don't check anyone's status at the door and say we won't see you because you don't you're an overseas visitor, or that you should be seeing your GP instead of coming to us, or whatever the background is. We'll see anyone. If there's complications about visa statuses and things, we just deal with that later, which is the best thing. So anyone will get the treatment they need at the time, and everything else sort of gets sorted out downstream, and that's the perfect way. So as long as you come into the hospital and you're triaged, you'll be seen by health professionals. That's the bottom line. It's as easy as that. As I said, previously, that the ranges of services in health is basically your inpatient versus your community, which is the next slide. So you've got, you know, your trauma, your ICU, with transplants, pediatrics, maternity, emergency, that sort of stuff. And then you've got all the other things in community. So if you're looking for a career in health, don't limit yourself to just inpatient social work, because there is so much other diversity and jobs out there. You just have to be creative when you're searching the health webpage about looking for the type of jobs that may consider social work, a social work degree as into that particular role that they're trying to fill. Not all jobs are social work type jobs as well. So there's I said that's the real diversity of health. So the funding, as I said, is largely comes from New South Wales Health. That's where we get, that's our main funding body. However, some services like aged care are federally funded, and then there are some positions that are funded via the medical streams that may decide that they need a social worker attached to their program, such as cardiac rehab. We've been trialling a weekend emergency aged care service, so that's coming out of aged care, inpatient aged care money. There's other trials with there's cardiac, there's lots of different we're trialing pediatric social work care on the weekend. So again, the pediatric team will be looking after that as well. So there's lots of different funding that supports us. At the end of the day, you know, it doesn't, as long as you get paid, I guess, for the work you do, you're doing okay. But that's where sometimes the role might be called something a little bit different, but they'll still actually be looking for social workers. So so the social work role, so just 2 slides on, I think, please. So the social work role is largely to provide emotional and psychological support to patients, carers and family. And we largely do this by doing what we call a psychosocial assessment, which is a standard template that we do to sort of get the most information we can out of families or patients to help us assess what we might need to do with them while they're in our care in regards to support, to discharge planning, to adjustment to their illness, whatever's going on. In emergency and intensive care, in neonatal intensive care, a lot of the work is crisis intervention. We're reacting to whatever the trigger, the crisis that is for that person at that time, and we're trying to look at what the resilience they've already got to actually help them manage that crisis, or help them develop some strategies to manage the real upset in their life at the time, and hopefully not make it worse for them as they're progressing through whatever trauma is happening for them. A lot of the work is an adjustment to illness. We do a lot of work with people who come into hospital with unknown conditions, and they get diagnosed with things like you know, multiple sclerosis or cancers or things like that. So it's getting people to understand that. I've just had a patient who's been in hospital for most of the year, and he's finally got to rehab, but he came in with a broken leg, which turned into a below knee amputation, which then turned into an above knee amputation, just because of the infections and the difficulties with his recovery and the surgery. So a lot of that work with him was about, you know, getting his head around the initial loss of his leg, and then because going from a below knee to an above knee amputation is a big has a big impact on your recovery, your abilities to get prosthesis quickly and get back to work and those sort of things. And this is a man who is motivated to get back to work and what have you, and he just realized that this has probably knocked him another sort of 6 to 12 months back. So how does he keep buoyant and positive and focused on the end goal when at the moment his body's sending all these signals to him that it just wants to not move and what have you. So finally, medically, we got him sorted and he's gone off to rehab really positive, which is really good, but it was over months giving him very regular support to adjust to that. The other thing that we do a lot of, and this is not just specific to women and child's health, it is child protection and domestic violence. We're always having that in the back of our mind when we know there are children in the home, if we know that there's potential. There's a lot of screening that's happening in hospitals now that we're trying to screen for domestic violence because it doesn't always present as obvious as a physical injury to the person. It can come in, it can manifest in many ways, and hospitals are often seen as a safe place for people to disclose. So that's always in the back of our assessments to be you know, looking at those sort of things. And then we do the discharge planning, which is making sure people go home with the right services that they need, with the right supports in place. We're doing a lot of NDIS applications at the moment. If the NDIS is required to assist them to successfully discharge, then we're starting that process in hospital. And sometimes we're following it right through till the plan's in place. If it's unrelated to the presentation, then what we do is that we're just liaising with support coordinators, we're liaising with the community. So it's a lot of advocacy, a lot of negotiation, a lot of liaison with our services and things. So it's a lot of busy work a lot of the day as well. So I think sometimes the hospital would like us just to stick to the discharge planning, but as I always say to my students and new staff, is that you know, I always think how much worse would the journey be if there wasn't a social worker in the hospital, because I think we sometimes just stop and pause and we look at the system that they're a part of, and not just them and their medical condition. And I think that's so important as well. So social work positions in health. There's lots. As I said, you've just got to be creative with what you're looking at. So don't just stick to looking for social work level 1, 2 jobs. So an entry level social worker, it would be paid at a level 1, year 2, I think is what it is in health. And then as based on, you know, experience and seniority and where your career growth takes you is where you apply for higher level jobs, or you get positions regraded on a personal sort of level as well. But within the level 1, 2 area, which is what you should be looking at going for as new grads, you incrementally go up in pay for about, I think, 8 years before you then level out at, I think it's level 2, year 4, I think it is. And people are happy to stay there, or people then want to look at other jobs and go into more senior sort of positions. So regardless of your level of experience, go for the level 1, 2 jobs initially, and then and they're generally called, will come under social work jobs. Other jobs to look at within health are things like your drug health counsellor roles, mental health, sexual assault, carers program coordinators, health prevention, Aboriginal health workers, you know, anything. They'll often let you know within mental health, for example, they'll actually say they're looking for a mental health worker, and within that they'll say they're looking for you know, people who have, you know, Bachelor of, you know, social work, OT, sometimes physio, depending on what they're actually looking at for that. So it's worth being a bit broad, I guess, with what you're looking at, depending on what your interest is and where your interest lies. The next slide, I talked about why I chose to be a social worker in health. I don't know if I chose health as much as health chose me. It's worked. I like the variety and I like the pace. Liverpool is busy and it's hard some days, but it's also really rewarding. It's a real privilege to be able to walk with people through really difficult, sad times in their life. And you know, I enjoy ED. It sounds sometimes a little voyeuristic to be there when there's a big trauma happening, but I like the environment of being down there with that multidisciplinary team and really getting involved in a trauma. But when you step back from it, it's about being able to walk with that family through that and being able to give them the right support and answer all those questions that in health we forget that. You know, that not everyone speaks our language, that you know, that sometimes families don't get what we're saying to them. So to be able to be that conduit between the family and the doctors sometimes, and to make sure to those basic needs, you know, do they need water? Is someone not looking after their medical care because someone's, you know, in hospital really unwell? That carer focus, the focus on, you know, do kids have to be picked up from school? All the things that obviously doctors can't possibly, or nurses have in their head when there's a trauma coming in as well. I also like the balance. I know myself is that I will never be a counsellor in regards to being in a therapeutic counselling environment. It's just not me. But I get to do support, even short-term counselling, which I really enjoy. And between that and then the practical aspects of my job, I find I get really nice balance. So again, this suits me. I like the fact I work with other professionals, and I like that I know what other professionals do and I can work collaboratively with them, and we work together. Liverpool is supportive. We really support all our staff, in particular our new grads. We really do look after and make sure that they understand you know, I guess what our expectations are, what our role is. I've liked the fact that I've been able to specialise. Now, I didn't go into health to specialise in neuro. It just sort of happened. And even though I'm currently not in neuro, I still, because I have so much knowledge and experience there, I still do call myself a neurosocial worker. But really, I could probably now confidently say I'm more a critical care social worker. That's what my general specialty will be. But again, you don't have to specialise. That's more if you have an interest and you then pursue it. And that's when you can specialize, you can then do things like, you know, I've been involved in setting up a Parkinson's support group, a brain tumor support group. I've done rehab on, I've done research in stroke. I've done education I've spoken at the Parkinson's Association. You know, I've spoken at the stroke workshops and things like that. So there's lots of scope there once you do start to specialize and get some particular expertise in an area. It's been good for me. I've been able to progress in my career. I've been a team leader. I was a team leader quite quickly. I think after about maybe 6 years of working, I was a team leader. I chose to no longer be a team leader for personal reasons. I felt the balance with my kids and my family was not what I could give as in a part-time capacity, so that was my choice. But then I've had the opportunity to remain a senior within the department and move into my educator role, which has worked out really well for me. We have really good supervision and support. So there's always people, we're trying a new mentoring approach with new staff. So they've got people to go to that they can ask questions of and what have you. And the supervision is very solid. You will get your weekly, fortnightly, monthly supervision, whatever level of experience that you need to get. There's lots and lots of professional development. We have team-based professional development. We have department-based professional development. And sometimes there's also area-based. We're starting to make links with universities who come in and do talks with us as well to help us keep current in the field as well. So there's lots and lots of ongoing learning. And then there's the flexibility, especially at Liverpool, any of the big hospitals where there's weekend work, evening work, there's lots of flexibility to where you can go as well. So I guess the challenges of working in health is it's busy and you have to be fairly organised. I won't show you a picture of my desk, which is chaotic. It is probably the best way, but organisation, I've had to learn to be very organised. It's not something that comes naturally to me. And you are doing lots of things on the hop, and it's not uncommon to be taking a phone call, typing notes, answering an email, all within sort of 10 minutes. It's a difficult caseload. Some of the cases are really tough and really sad and really challenging to be. You know, you often are the target for the family to offload, and which is such an important part of our job. But it's a matter of learning how to not take that personally when it's coming at you as well. I'm not sure. The other big challenge is that we're working within the medical model of care. So we're actually working to the doctor's timeline for discharges. We're working to, you know, they think they've fixed a problem, they're willing to discharge someone. And so that can come with its own challenges, where you find you have lots of arguments with doctors about when a person is ready to go and getting the time that you need to make sure that it's a safe discharge. And I often argue with doctors is that if you give me an extra day or two, I can mostly guarantee that the person won't go home and fail and end up back with us. That if I have that extra bit of time, I can actually make it a more successful discharge and do what I have to do. And it's that ongoing advocating that we do for people that don't always understand what our role is. It's really common in hospitals that the doctors go, oh, the physio's cleared them, they're mobilising, they can go home, not realising there's so many other factors there. And then in health, in any government job, there's lots of meetings, there's lots of admin, lots of writing in notes on the computer now. So that's a big change that's happened as well. But you know, you sort of roll with them. So as I've said, new grads. So for new grads, so health definitely employs new grads, and you you don't necessarily need to be looking for new grad jobs, new grad social work jobs. Any social work job that's a 1 or 2, generally go for it. Generally, previous experience on a placement is preferred, but it's not essential. And I would encourage people to still go for jobs. I guess in a competitive market where there's a lot of social work grads coming out, people need to cull, and I can't talk for all hospitals and how they do their recruitment and culling, but sometimes there needs to be a way that they need to, you can't interview 30 people for one job. You have to draw a line somewhere. So it's previous experience on placement is preferred, but it's not essential. So if you are keen for the job, please go for it. It's always really good to every job will have a name of a person attached to it. Ring up and talk to the whoever's recruiting. It's most likely going to be the team leader of the team where the vacancy is. And we remember when people call us and they seem keen and want to know about the role. Know what you're applying for. I've sat on many interview panels where, you know, I've sat on a community program and one of the persons just didn't even know what the job was, didn't know what we were doing. And so it's really hard. He was unable to answer the questions well because he just didn't get the job. You don't have to know 100% what a social work role in health is, but you have to have some understanding. An understanding of the day-to-day social work practice is helpful. Again, not essential. And I know from experience, we've employed a lot of our students over the years because, you know, they've enjoyed their time here and they've been keen to continue with us as well. So I think what I did the last slide's just a summary of what I enjoy and what you need to know. Coffee is life. Finally, we now have decent coffee in the hospital. Oh, it's taken a long time. So that's a big one when there's some days you walk in and you just can't start without your coffee. It's dynamic. It's definitely not boring. It's collaborative. You are well supported and you can specialise, and you don't just work within your social work group. You actually have that diversity. But you need to know is that you have to be a team player, especially if you're in a environment where there's multidisciplinary people within the team. You will have bad days. There'll be days that you walk out and you just think, I've achieved nothing, everything was hard. I haven't had to, and I'm very fortunate, I haven't had to do a SIDS death in a while, but I was talking to my colleague yesterday and you know, when parents have to leave the hospital after having lost a baby and they walk out of our emergency, if that's where the baby has died, watching them walk out is one of the saddest things. That memory is burned in, that image is burnt into my brain about how sad it is. And there's just some days that you just can't shake how sad that is, and looking at, you know, what your role was and how you were supporting them and stuff. And they're the really tough days, and that's when you really need to get good support and debriefing support and supervision support to talk about those cases. Supervision, you have to prioritise. The sooner you do it earlier on in your career, the better, especially probably in every area, but I know in health is that it's really important that you do make supervision work into your week, because it can be easy to cancel. And as I said, it can be hard and disheartening. A lot of the work's on computers now, so you have to be prepared for that. But again, you can make a difference, and you do make a difference. People do contact you sometimes weeks, months, years later, because you were helpful for them and you made a difference. So they contact you to help again, possibly. You do meet really good people, and you can really make some great bonds with your colleagues. Like any area, burnout is real. And self-care is really, really important. Sorry. Typing notes and writing reports is very time consuming. And more than ever, what I've learned over the years is that you need to trust your instinct and really go hard to advocate for your patients. The very last slide just has for you the New South Wales Health links about where you go to look for social work jobs in health. They're the best places to go. All health jobs will go through the New South Wales Health page, and that you apply online and you attach your resume and any other things they ask you via that portal. And that's about it.
That is awesome, Siobhan. You have a bit of a cough there.
I did. That's why I brought my water, sorry.
Just when you were talking about self-care Yeah, you were.
Yeah.
Such, such an awesome range of skills and expertise that you've brought to us for our attendance. It's just so, it's refreshing to hear the passion that you bring after 20 plus years of practice. And thanks for letting us have an eye view on your office. That's worth its weight in gold as well.
Sorry.
To sort of just but to see the reality of being inside an office. This is where you're working. This is your work. And so often that's half the demystifying thing that people are keen to know. Now, Rabina and Kamal might chip in at some point, but there's a question. One question was, is there a chance to, do you ever offer opportunities if people have taken on board how complex the roles can be? Is there ever a chance for like having a, coming in and visiting and spending time for a day? Does the hospital offer that kind of service to prospective applicants?
Not specifically. Generally, if you could come in and meet with a team leader if that's what you wanted to do, and talk about things if they were able to offer you time to do that. I guess it was just sort of have a look at the hospital and see how we work as a social work department without being attached to a uni as a student, and not having that Clean Connect approval. We have a lot of problems getting visitors on site, especially with COVID at the moment, as well. So not really when you're looking for a job, but but saying that, I would still encourage people to make that phone call to the team leader, because they can tell you a lot, and so can the New South Wales health webpage. There's a lot of really good information about that, so that's where I'd encourage people to go.
Yeah, that's great. Another question, it's sort of a combined question, was how do you manage when patients who've been discharged, like you mentioned, sometimes people contact back and then they contact back for support. How do you manage that if they haven't got a current issue that relates to service at Liverpool Hospital? What do you do about that?
So I guess I can only speak for myself, but I always extend out to my patients and families that they can call me at any time, because my logic is that health is confusing and difficult, and they're often doing this under the background of a trauma or a disability or a diagnosis or something happening. So if they can ring me and make one phone call, and then I can go and make 50 phone calls and come back to them with the one answer they need, I've helped them. And so I extend that to my families anyway, and help them out, because I find that I've probably got my fingers on the resources much quicker than what they do. So it's often that we're limited in as far as that we're generally just resourcing them about who to call next, who might be able to help them, referring them on to Carer Gateway or to back to their NDIS coordinator or something like that. So that's where we can't actually physically see them for counselling support. We generally can't bring them back into the hospital to be seen, but we can still try and advocate and support and refer them on.
That's great. Another question was, how do you work with the medical model?
It's hard. It's really hard. It's frustrating at times. It's such an old model of care. It's so traditional in so many ways. It's very frustrating. But the hospital health has done a good job in recent years, where we are trying a more collaborative approach. We have a journey board meeting every morning on, I think, most wards. We have where the doctors are generally meant to attend. On my ward before COVID, we would have it's called an In Safe Hands rounds, where one of the orthopaedic specialists would come to the ward, and we would go from every bed and we would talk to the patient, and we'd encourage their relative to be there with them, and we would say, this is what we've done, this is where we're up to, this is where we're heading. So they were very much involved in the care. So we're trying to put the patient back at the center of the care, as opposed to the specialist coming in saying they can go home tomorrow with no input and no discussion. So we're working really hard. What it means is that sometimes you end up having lots of arguments with doctors and sometimes nurses, and demand management about expectations. But again, I just see that as an extension of our advocacy role. And it's frustrating. There's not going to lie. It can be really, really difficult. But I still, the thought that gets me to sleep at night is knowing that I've made the journey better for that patient, that I've done as much as I can. And sometimes discharges are not ideal, and they're not perfect, and they could be better. And sometimes people do bounce back because doctors don't listen to you, because at the end of the day, ultimately the doctor's responsible for the discharge, regardless of our input. You know, and sometimes when they do bounce back, you do feel like, you know, doing the "I told you so" dance and what have you. But you sort of just give it everything you can with what you've got. You know, we don't sit back passive. We don't just let it go. We do fight. We sometimes have to really get on our toes and you know, advocate against the system that we work in sometimes.
That's fantastic. How, yeah, you must, that coffee, it's doing its job, isn't it? That's great.
Yeah.
We've got the very common concern, and you've covered it, and I know you're tuned into this concern because of the field educator role you have, and you come and do the lectures with us and stuff. But do new grads really have a chance at all? And you've said, you know, as you said, you can't interview 30 people, and you do need to cull, and you can't be responsible. You don't know what other places are doing in terms of, is there, other than, so you mentioned contact the contact person in a job ad, make sure you contact that. Is there anything else special that you'd suggest a new grad should emphasize in their application?
I think so. Any experience is valuable experience, even if it's not health experience. I think people sometimes lose sight of the fact is that I didn't do a hospital placement, therefore I can't work in health. And you can, because you need to look at the transferable skills that you've gained on your placement, and that's what you have to talk up. So in your application, you'd be, you know, if they ask for, you know, as a desirable, for example, experience in oncology or what have you. And you can say, despite not having direct experience with oncology, in my work in disability, I was able to advocate for my patients, and we were doing adjustment to illness, or whatever you were doing that was valuable to show that you, although you don't have that exact experience, is that you have the skills that they could apply. You need to, don't just sort of dismiss yourself because you don't have that exact experience. Give them what you got. You know, no one reads you know, your applications line for line, like every word. Like we're looking for the main, look, some people might, but from a time perspective, I don't think anyone does. And so what you're trying to do is you're trying to glean the experience and how well it's written. You know, things like grammar matter, things about give examples. Like it does make your application a bit more lengthy, but you know, if you can show an example of how you've, you know, you understand the complex needs of, you know, neuro patients or whatever the job is, then give examples of that. You know, I had a patient who had X on my placement, and this is what we, and it could have been NDIS, it could be, you know, in a council role or an intake job somewhere. Use those examples to show that although you don't have that direct experience, you still know it, and you've still got the skills that can do it.
Yeah. And the you know, would you, so with a thoughtfully framed thing, if somebody's had personal life experience, like, you know, somebody who's, you know, they've walked alongside of a partner or a family member with cancer or something like that, would that be appropriate to mention, do you think?
It can be, depending on, I guess, what the essential and desirable are. It's not uncommon for people to say that, you know, as a carer, I've been on this side of it, and I'm keen to be on the other side of it, and I've gained all this information about carer services or whatever, just by being that person, and as well. So
no, that's great. Yeah. So Rabina, did you have any questions?
Give me a second. Sorry, I really.
Oh, sorry, I just threw it at you.
Okay, while Rubina is finding, I can ask one question.
Thanks, Kamal.
So, do you offer voluntary opportunities as well? Because one of the question was also in the chat box, and I am also keen to know that.
Do we offer what? Sorry, I missed the beginning.
Voluntary opportunities for new grads.
what is it? What
Voluntary.
Voluntary? No,
Yeah.
in health we can't do. There's no voluntary roles in social work in health. It's mainly, I think, for insurance reasons, I believe. So there's no. The volunteer stuff we have here is like ward grandparents, people who work our we sell secondhand goods and stuff like that. Sometimes people go with the trolleys where they take magazines and what have you, but there's no volunteer positions for allied health. The closest we get is people who come in as allied health assistants, who are paid, who are here to work, but they're not volunteers. No.
Thank you.
Okay. I don't have any questions.
Okay, I've got one. So is there training in relation to terms and language about working within the hospital environment? Or do you suggest that, you just pick it up as you go?
Look, a lot of it you pick up as you go, but there are policies within health we have a massive, it's like 30, 40 pages of abbreviations we use in health.
Wow.
That's a policy within itself. But some of them are medical and some of them are related to social work specifically. You largely pick it up as you go along. We have policies for most areas that we work in, and that's where you get your knowledge and language. There's nothing that you need to know before coming in regards to terms and abbreviations. Things like NDIS and things we would expect. I guess people know that sort of stuff as well. That's not specifically just health, but yeah, largely it's on the job. And I say that to students when they start with us as well. Just, you're going to pick it up. Like, I still go to women and child's health and I don't understand half the notes, and I'll be saying to the nurse, what's this mean? I don't understand that word. Well, just give me the snapshot of why this person's in hospital, because the language is beyond me.
Yeah, feel strong enough to ask that question.
Yeah.
And one of the other questions was, is it a risk, new grad, come out, seek a specialised position, or would you suggest, and I suppose with specialised language and in-depth understanding, that you have to build around that specialisation, or would you suggest you really should start with a general position, if at all possible?
So with like Liverpool, so what we do, we'd advertise, say, a level 1-2 job in palliative care, just for example. So that doesn't mean that you're going to specialise in palliative care. It just means that that's where you're going to be based for that position to start with. What then generally happens is that while people have been in health for a while, they go, I really don't like palliative care, or I really do enjoy palliative care. I'd like to stay here. I'd like to keep growing, or I'm not loving it, but hey, look, there's now a vacancy in oncology. I might go over to oncology. And then, we often have staff movements within within our department for that reason. And so vacancies can pop up in all sort of different areas. What I found is that once I was in the job for a while, I knew what I liked. I started to work out the type of cases and stuff that I liked. So I don't think you'd find any 1-2 positions that are specialized as such. What you find is that they might be attached to a particular clinical area, but that doesn't mean that you're necessarily, what you'll find is that after 6-12 months in the job, that you find that you know a lot about that particular medical condition, and therefore the psychosocial impacts of that condition, and so you are starting to get a specialization, but then that's also when you decide whether you are going to stick there or whether you're going to move on to something else. You just got your foot in the door to health to go, yep, this is the sort of job that I want.
That's great. Kamal?
Siobhan, there are many international students as well. Is there any visa status problem in that? Can you share?
Yeah, absolutely none. Like, as long as they've got the right visa to work in Australia, they're fine. We've actually got someone in the department now who has got an international student. So, yep, no problems at all with that.
Okay, thank you so much. Yeah.
That's great. We've also got a question. Does it help, do you think, to have a health qualification, like a certificate in community health or a diploma?
It's not a disadvantage, but it wouldn't necessarily be. So when we recruit in health in particular, it has to be a Bachelor or Masters of Social Work. You have to have that degree. That's the very top essential criteria that's there. Anything extra that adds to your experience and your breadth of knowledge is just an advantage. So it's not necessarily a disadvantage if you don't have it, but yeah, it's great if you do.
Yeah, that's great. So I think I've come to the end of the questions. Would Rabina and Kamal, would you agree? Or has anybody got,
Yes.
I mean, I think your PowerPoints have been fantastic. Sorry, Kamal, go on.
Yeah, I said we have like covered most of the question. If anyone has like any other question, they can ask.
Yeah. Siobhan, awesome contribution to everybody building a sense of confidence. It's so great to have, you know, the door open in the way that you've offered it. That PowerPoint is worth gold. And so anybody who's been querying when is this recording going to be available, probably in about a week, we'll put it onto the course sites so that people can, you know, follow up and listen again if they need it. Would it be okay with you, Siobhan, if I share the PowerPoint at all? If anybody emails me?
Yeah,
is that okay?
yeah, that's absolutely fine.
Great.
Yeah. Can I just say something else going out? This
Sure.
is sort of more a global comment in regards to going for jobs and what have you. Running applications and going for interviews is a skill in itself. So if you can deal with the rejection that you will inevitably get, and I can see Kate Draper up on the screen, and I know I've told her this. Hi, Kate. That if you can deal with the rejection that comes with maybe not getting an interview or not getting a job, is put yourself out there, because you find you get better the more that you do. The more you fine tune your applications, you find that what you didn't do in one interview, you might do it the next, because you've learned this. Health interviews are not, they're quite same. There's a general flow that goes to all of them, and once you've done a couple, you sort of understand that, so you sort of are more prepared then to answer the questions adequately. So I know it's a time issue, and it's about writing applications and then going in for interviews, and maybe, you know, it is hard when you don't get jobs. We've all been there, but really, if you are passionate enough about it, really put yourself out there and get the follow-up feedback if you don't get the job. And it could be just a matter of, you know, there was just someone who interviewed better, or there was someone, you know, that provided something different that they were looking for, because what they're also looking at is how you fit into the team that they're recruiting to as well. We don't want a team full of very experienced social workers, because we need the balance of, you know, new grads and more experienced social workers, just for lots of very positive reasons. So I think it's really important that give it a go, like just get out there and don't be scared off by the essential and desirable criteria and what have you.
And yeah, like you say, to learn from each experience, to have the resilience to also open up to what can I learn from this, and not feel just crushed. And you know, to know that, as you say, like everybody's gone for jobs they've not got. You know, absolutely everybody, even Donald Trump. Yeah. I think, you know, just keep brave and keep strong about it. We've had a couple of neuroscience. Somebody's very keen to know, is there a core next, you know, step to find out a bit more about neuroscience that you would suggest somebody follow up? Like,
if you're looking for jobs in neurosciences, you're looking for jobs that are like on the stroke ward, rehab, neurosurgery, those type of jobs. Like I know there's Huntington's disease social workers, there's MS social workers, you know, who work at the MS Society, things like that. That's the sort of neurosciences is the field. So anything to do with the brain and spine is what neurosciences is. So neurosurgery, neurology, stroke, they're the things that you'd be looking at if you had an interest in those things. And it's a very fascinating area. I can speak very highly of it. I've learnt a lot over the years being there as well. But that's what you'd be looking at. You'd be looking at jobs that have stroke, rehab, those sort of things.
And just one more mechanics. Would you say, is there information about the levels 1 and 2, you know, that whole structure of what social work, is that on the New South Wales Health website, or where would somebody find out about more?
I can find that out for you and probably email you something off. I haven't looked at the webpage in a long time. I'm not currently looking for a job.
No, I don't want to give you more.
Look, I could definitely find out for you. We used to have a table that used to say what your entry income would be, and then what incrementally it would go up as of whatever date. All I know is that as a first year out, you are a level 1 year 2, and and then obviously at 12 months, year 3, year 4, then you become level 2, year 1, and then 2, 3, 4, and then that's where you stop, unless you then go for other jobs and with other experience and things. So
totally based on your length of service.
Length of service, yeah. So that's for the
Absolutely.
first
Well, that's
8
great.
years.
Yeah, that's great. That's great. And so people can all aspire to being field educator coordinators as well in the long term,
Yes.
you know, but only up
Very
to
rewarding.
Siobhan, thanks. That's just been awesome. Everybody's really appreciated your it's coming through on the chat how much people have appreciated. What I just want to let people know that there's another session at 2 p.m. today on Mission Australia are going to give a presentation hour. And then Friday, we've got back-to-back sessions. So have a check out. We've got, we've got Life Without Barriers, Settlement Services International, Social Work World of Work Career Hub is running a special social work setup, and I've asked them to look at that whole issue of structures and unions and award wages and things like that. Then we've got Lifestyle Solutions at 2 p.m, then Headspace, and then ASW, and then a wrap up. And we will do the raffle of the lucky Zoom prize. So thanks for your patience. Siobhan, thanks for your resilience in coming online. And thanks to the Social Work Careers team for the questions and being organised and supporting the whole activity. Thanks everybody for your questions.
Thank
All the
you.
best.
Thank you, Siobhan. Thank you so much, everybody.